Hello everyone. So in this video I am going to explain the plasma cell dyscrasis. Plasma cell dyscrasis. So in the plasma cell dyscrasis, first is the multiple myeloma. So in the multiple myeloma, so what do we mean by the multiple myeloma? Basically it is the tumor of the plasma cells. So it is a tumor of plasma cells. So multiple myeloma is the tumor of the plasma cells. And in this, what is the most common genetic alteration we see? So the most common genetic alteration in multiple myeloma is, please remember it, that is deletion of 13q. And here is one more important point, that deletion 13q is seen in the CLL and also in the multiple myeloma. In these two conditions, deletion of 13q is the most common genetic alteration. So the most common genetic alteration, that is deletion of 13q, is seen here. So in the multiple myeloma, what is the clinical feature what we find in the multiple myeloma? That is the lytic bone lesions. Lytic bone lesion is seen, and it is most commonly seen in the vertebra. So it is most common seen involvement of the vertebra. So lytic bony lesions were seen. Lytic bony lesions were seen, most common vertebra. Now for the diagnosis of the multiple myeloma, so for the diagnosis of the multiple myeloma, we see the blood picture. And in the blood picture we find that there is a stacking of coins is seen. So RBCs, we see that there is stacking of coins were seen, which is also known as Rolex formation. Please remember it, that Rolex formation is seen in the blood picture of the multiple myeloma. Now in the white blood cells, so RBC has the Rolex formation. For the white blood cells, we see that it is increase in the plasma cells. So increase in the plasma cells, and we see the Russell bodies. We also see the Dutcher bodies. We also see the Mott cells. Mott, or the other name of Mott is Mulberry cells. And flame cells. So white blood cells, all these were seen in the multiple myeloma. Russell bodies, Dutcher bodies, Mott or Mulberry cells, and flame cells. So in the Russell bodies, so here as we see here, we can remember that it is a Russell body. So it is a Russell body. How we can remember that it is a Russell bodies? So as we know that Russia is in the periphery side, so here also the intracytoplasmic inclusion is seen. As we see here, this is a intracytoplasmic. The inclusion is seen in the intracytoplasmic. So intracytoplasmic inclusion is seen. Intracytoplasmic inclusion is seen in the Russell bodies. So it is in the cytoplasm. The inclusion body is in the cytoplasm because it is towards the periphery. So here the Russia is towards the periphery. So that's why it is a Russell bodies. While in the Dutcher bodies, as we see the intranuclear inclusion is seen. So all these inside the nucleus, we see the intra inclusion bodies. So intranuclear inclusion body is seen. Intranuclear inclusion body is seen. And intranuclear is seen in the Dutcher bodies. So all these were the Dutcher bodies. So this is the way how we can remember the Dutcher bodies and Russell bodies. Russia is towards the periphery, means in those intracytoplasmic inclusion is seen, while in the Dutcher bodies intranuclear inclusions were seen. And this is the intracytoplasmic inclusions. While in the Mott or Mulberry cells, as we see here in this image, in the Mott or Mulberry cell, this is a Mott cells or a Mulberry cell. So this is a Mott, or we can say a Mulberry cell. Mulberry cell is seen here. So this is a moat or mulberry cell, and in this what we find? We find both intranuclear and intracytoplasmic inclusion. Means in this inclusion is seen both in the nucleus as well as in the cytoplasm. So intranuclear plus intracytoplasmic inclusion is seen. Intracytoplasmic inclusion is seen. Intracytoplasmic inclusion is seen. Please remember that both intranuclear intracytoplasmic inclusion is seen in the moat or mulberry cell, which is seen in the multiple myeloma. Now this is the last one in which we see that a flame cell is seen. So here we see it looks like a flame. So it is a flame cell. It is a flame cell. It is also seen in the multiple myeloma. So these were the findings: Russell bodies, structure, moat or flame cells. All these were the white blood cells finding in the multiple myeloma. Now what is the criteria for diagnosis of multiple myeloma? How we can diagnose? So the criteria for multiple myeloma. So for this we have to remember that for the criteria of multiple myeloma, we have the plasma cells. We have the plasma cells which is more than equal to 10%, plus we also have to remember CRAB. Please remember it. CRAB is also found in the criteria for multiple myeloma. Plasma cell is more than equal to 10% and CRAB is also seen. So for what is the full form here for CRAB? C stands for increase in the calcium level. R stands for renal insufficiency. And A stands for the anemia. And B stands for the bony lytic lesion. So CRAB includes the increased calcium level, renal insufficiency, anemia and bony lytic lesions were seen. Now for the diagnosis of the for multiple myeloma, we also have find M spike is there. So diagnosis of M spike is seen. Diagnosis of M spike is seen in the serum or urine electrophoresis. So in the electrophoresis of the So in the electrophoresis of serum or urine, we find the M spike is there. So M spike is there, and M stands for myeloma. Please remember it that M stands for myeloma. So in this there is increase of IgG level. Please remember it. Which immunoglobulin is raised here? So here IgG level is raised. Immunoglobulin G level is raised in the serum or either in the urine electrophoresis, that is M spike. So that's all about the multiple myeloma. I hope you get benefit of this video. Thank you. Bye bye guys.